Hi, I'm Amelia De Lorenzo.
I'm Ellie Baumsta,
And I'm Sebastian Angulo.
and we researched the effects of early brain development in neurodivergent individuals.
All right, so we're going to start by going over our roadmap. So at the very beginning here, we're going to talk about our research question. And then after that, we're going to go into some background information on what exactly a neurodevelopmental disorder is. After that, we will move on to what the impacts of neurodevelopmental disorders are on the brain or how they show up in the brain. And then after that, we will review the primary source and finish it out by talking about our conclusion and key points.
For our research, we wanted to explore how early brain development in individuals with neurodevelopmental disorders, from now on referred to as NDDs, influence cognitive and emotional functioning later in their life. Why does this matter? We feel that this matters because our research unveils that up to 18% of children are likely to have an NDD, and it also suggests that this number will only increase as time goes on. What does this mean? As a parent, it is also important to attend to the special needs and circumstances of your child to ensure they'll have a better quality of life. This means the child may experience difficulty learning, behavioral problems, underdeveloped social skills, emotional control, and can even have trouble with family relationships or making friends. Because of this, they are also 13 times more likely to develop a mental illness, such as severe depression. What can be done for them is supporting the individual in early stages of their childhood. The use of interventions prove to be effective in treating disorders, such as pharmacological and non-pharmacological interventions. For clarity, pharmacological interventions involves the exclusive use of prescription medication. For example, methamphetamine is typically given to patients with ADHD or narcolepsy to improve focus and attention and promote wakefulness. Non-pharmacological interventions is a method that utilizes the initiation of behavioral changes and practicing social skills and alternative learning procedures. It's also been found that the combination of the two interventions proves to be more effective than just one.
All right, so what is a neurodevelopmental disorder or NDD? An NDD is a condition that is the direct result of the atypical development of the brain and nervous system. It usually occurs before birth, but can also be the result of circumstances or conditions during early childhood. NDDs can affect how a person thinks, communicates, behaves, learns, and regulates their emotions for their entire life. A couple of examples of NDDs include autism spectrum disorder, attention deficit hyperactivity disorder, or ADHD, intellectual disability, learning disabilities like dyslexia, and communication and motor disorders. So, how do NDDs appear in the brain and how do they impact the brain's development? So the brain of a person with a neurodevelopmental disorder or NDD doesn't usually appear structurally different. There are no regions that are missing. The differences are in the timing of the brain growth and in the connections between neurons. Keep in mind that these aren't universal. Even within people who have the same NDDs, okay, so the first thing that can potentially cause an NDD is a difference in when certain lobes of the brain grow or the speed of their growth. For example, some people with autism have early brain overgrowth, and some people with ADHD have delayed maturation in regions in charge of attention and impulse control. But this isn't the case for everyone, and honestly, these are a lot less common causes. The main cause of NDDs is brain connectivity, or how the different regions of the brain communicate with each other. It differs based on the specific NDD, as with some disorders, connections are stronger than in a neurotypical individual, while other disorders have weaker or less synchronized connections. The last factor that has been shown to cause NDDs is problems with the neurochemistry. For example, cases of ADHD, it has been shown that individuals have issues with their dopamine regulation. Similarly, in many cases of autism, individuals have problems with the balance of their inhibitory and excitatory neurotransmitters.
For our primary source, we used the associations between multiple neurodevelopmental disorders and mental health in children. And this research explored the severity and likelihood of developing depression and anxiety disorders in children with multiple NDDs aged 3 to 17 years old. They utilized data from the United States National Survey of Children's Health between the years 2016 and 2023. And in that research, they found that children with multiple NDDs are 4.7 to 5.3 times more likely to develop depression and 5.8 to 12.9 times more likely to develop anxiety disorders compared to those who do not have multiple NDDs. On top of that, they are also 7.8 to 16.9 times more likely to experience much more severe depression and 8.1 to 34.9 times more likely to experience severe anxiety compared to individuals who don't have multiple NDDs as well.
Our key takeaways from this research about what a neurodevelopment disorder is. A neurodevelopment disorder results from atypical development of the brain and nervous system, usually occurring before birth or during early childhood. Um, NDDs are lifelong conditions that can affect learning, communication, behavior, and emotional regulation, but with support and interventions can improve functional and quality of life, which include autism spectrum disorder, ADHD, intellectual disability, learning disabilities such as dyslexia, communication disorders, and motor disorders. How do NDDs affect the brain? NDDs are lifelong conditions that can affect thinking, learning, communication, behavior, and emotional regulation. But with support and interventions, one can improve the function and quality of life. These interventions include pharmacological medications and non-pharmacological therapies, skills trainings, and educational supports. Um, the primary issue is often due to brain network connectivity because mechanisms vary. Two people with the same diagnosis can have different strengths and challenges. Neurodevelopment disorders stem from early differences in how the brain develops, connects, and communicates. These differences affect thinking, learning, behavior, and emotional regulation across a person's life. Early challenges that one may expect for individuals with NDDs may be an impact on school success, relationships, and self-control. Consequences of this may increase the risk for later development of depression and anxiety, especially when multiple NDDs are present in an individual. Because developing brains are highly plastic, early recognition and support matters. Because of that, a combination of both pharmacological and non-pharmacological interventions tend to produce the best long-term outcomes.
All right, and then this here is our works cited page and includes all of the different works that we used during our research. Thank you.